Welcome to the Malibu studio. I'm food and fitness coach Lori Corbin. Today we have a huge show about weight loss. Everybody seems to want to know about the injectables Ozempic, Weygovy and Mounjara. Now, these are out on the market. Everybody's using them. Some people want to, but it's expensive. They all want to know if it's going to work for them, how they're going to feel, etc. We have three top experts in their field concerning these drugs, what they can do for you, what they can't do for you, and what you might want to watch out for. So sit back and take a listen. Let's get informed.
Director of Vitality Labs at the Sports Academy, Dr. Alexis Daniels says it's crucial to work with your healthcare provider to come up with a plan that works for you and your lifestyle.
These drugs, Ozempic and Weygovy, primarily work on a peptide, or they mimic a peptide called glucagon-like peptide 1, GLP-1. And essentially this peptide works in your appetite in two areas. In your stomach and your gut, it helps create a feeling of fullness, so you feel fuller. And then in your brain, it creates feeling less hungry. And both of these work on appetite mechanisms. Originally, this drug was used for people with type 2 diabetes. That's when it was first approved in 2017 as Ozempic. And then in 2021, it was FDA approved and it received a different name, Weygovy, for just weight loss in general.
It mimics an exact hormone that our body secretes when we're full, okay? And this hormone that is secreted by the gut and the brain. And it acts on the brain and the gut and the pancreas to tell our body that we're full.
Owner of the Med Spot in Woodland Hills, cosmetic surgeon Dr. Michelle Reyes owns an age management business with hormones, weight loss, and cosmetic procedures.
The first thing that happens is our gut slows, our stomach slows emptying. So our body just basically, our stomach slows emptying, which doesn't necessarily correlate to severe constipation or anything like that. It just kind of makes you feel a little bit fuller faster. So basically, you start to eat and you're like, okay, I just feel like I'm fuller. Feel like your pants are tighter before they usually would.
Dr. Reyes explains how the set point theory helps to understand how these drugs work.
Something that we've learned kind of in like on the streets kind of thing is the concept of set points and the concept of where our brains kind of feel comfortable. And we've determined that obesity is kind of a multifactorial problem, but that once you get to a certain weight, and we probably all kind of can appreciate this concept of the set point, that we all know that our bodies at a certain time of our life, our bodies seem comfortable at a certain weight. And then we might have had some occasion to gain some weight. Say like, oh, we got pregnant and like we're really hungry and like gained some weight. And if we didn't work really hard, if people don't work really hard to lose that weight, if we stay at that weight, our brains and our body will get used to being at that weight. And then once that happens for too long, and it's an indeterminate amount of time, but we think it might only be maybe 6 to 12 months, if our bodies are at that weight, then we can reset our set point. So no longer am I like happy at like whatever, 125. Now my new set point is 135, and it's hard for me to get below that because I've reset my set point. So these drugs help us pull down our set point. So it doesn't matter if it's 125 to 135 or it's 125 to 200. It's it's the same thing in obesity, and then it's just and then the higher the weight gets, the bigger the problems get with, metabolically, et cetera.
Dr. Reyes works with a compound pharmacy to microdose the drugs for a slower, healthier response.
You can control how fast you lose the weight. You have control over that. It's not something like a bariatric surgery where you don't have control. And I think that that's a big deal. I think one thing that we learned in The Biggest Loser, that show, that was they did a lot of studies after that, and they learned that those people the clients in that show, that lost so much weight, they had a significantly reduced basal metabolic rate afterward, and it's difficult for them to maintain that weight loss because and most likely is because they lost the weight so fast. We can pace the weight and we can pace the weight loss, and we can do it in a healthy way. We can help people learn how to eat better. We can help people learn how to eat normal meals. Intermittent fasting isn't something that I recommend during these medications. It's not something I have to tell you, okay, now Laura, you're gonna have to eat this really weird diet. Okay, you're only gonna be able to drink fluids, or you only have these protein shakes or something. I'm gonna teach you how to eat properly, and three small meals a day, and maybe this is how you can do a snack, and all the meals are healthy, and it's healthy eating. And if we can get you off of the medication slowly and carefully as we release the apron strings, then you'll be on a good path to having new good habits and at a new set point. And that's our goal.
Even without type 2 diabetes, many Americans are trying this protocol. Most likely, there will be setbacks.
We don't know. We can't see into the future how this is going to be. Of course, there's going to be a lot of people that aren't going to be able to handle their new increased appetite off of the medicine. Of course, we see that. But there's going to be plenty of people that will be able to have learned from it, because clearly people learned a lot of bad habits during the pandemic alone.
Proper nutrition is the key to the success of this program, but many are consuming a highly processed diet.
The standard American diet is literally it's the bane of our existence, and the reason why I am as busy as I am, and the reason why we got so sick during the pandemic. I think America got probably sicker than everyone else because of that. And we learned that metabolic syndrome was probably the greatest vulnerable point for COVID, and then we just made it worse by sitting at home and getting fatter. So the diet that we're used to, our cereal in the morning and our orange juice and cereal in the morning, is literally just like a fast sugar diet, and maybe it's a little bit infused with some nutrients and a little vitamin D in the milk or something, but there's nothing about it that sustains you properly. And so you need to be on you have to have a high protein, complex carbohydrates. No, juices are not good. Smoothies are not good. Smoothies are good for, intense athletes. That's okay, but we're trying to get lots of calories in if that's what you're doing for a living. But most of us are not doing that for a living. And we have to start to change that way that we're eating, because the way that we're living is not as active as we used to be. And we just have to accept that, the number of steps I get in a day is a lot less than I did even 10 years ago.
One possible benefit of these medications is the ability to reduce or stop other meds, as other health challenges may diminish.
Significant drop in their A1C within 8 to 12 weeks, which is amazing. So their A1C will drop, their triglycerides will drop, their LDL will drop, their blood pressure will drop. As soon as people learn how to not eat the simple sugars, that's a big one, because insulin will keep their blood pressure up. So just a simple loss of your weight of just only 5% and lowering your intake of simple sugars, you can lower your blood pressure just alone. So blood pressure, triglycerides, so that's your lipids.
But doctors are reporting unwanted side effects with the standard dose.
The higher you go up in the dose, the more likely you can have some side effects from it. And so you can actually have a little bit of fatigue or brain fog from it, and it is out of proportion to your lack of caloric intake.
When it comes to losing this weight, Dr. Reyes says you are in the driver's seat.
The Mounjara, we go up just enough for people to lose the 2 pounds a week, and then that if it's 2 pounds a week, we find that people have limited side effects. If you go up too high in the dose and you have the brain fog, the fatigue, and severe nausea, constipation, even vomiting, it could be pretty bad. But in the beginning, we would prescribe Zofran for everyone, which is an antiemetic, but people don't really need to use that because we're very good with the dosing now. We just go up tiny bits, and we think that the smaller we go up in the dosing, we just kind of call it micro dosing. The tinier steps that we go up, the easier it is for people to tolerate it, and the better their bodies will accustom to it. And we can kind of hit their perfect dose.
When consumers get their weight down, then what?
That's been a big concern that, will people have to be on these drugs forever to maintain that same amount of appetite suppression? Yeah. But the idea, remember, is to try to get people back to their original set point. So once you get to your set point, that your brain is kind of working healthfully, that, that you actually have some set point there. Then we want you to be able to be off of it. So we're trying to get you to a point where you don't need to be on it anymore. So that's a big deal. So that's a big concern that everybody has, is if I start this, will I have to be on it forever? Or if I get off of it, will I just be ravenously hungry? So that's the biggest concern. Another concern that everybody has been having is, will I lose a lot of muscle mass? And I've been hearing, like, I was just at a plastic surgery conference, and the big term was Ozempic face, Ozempic face, Ozempic face, and I'm like, oh, I have Sculptra. We can fill you up. No problem, we'll fill you. But basically, if you lose fat, you're going to lose volume in your face. If you lose fat quickly, you'll lose it more quickly. If you lose weight too quickly, you will lose fat and muscle. You don't want to lose everything too quickly. Anytime you lose weight, you're gonna lose a little bit of lean body mass. If you lose it faster, you're gonna lose more. But anytime you lose fat, you're going to lose something maybe in your cheeks, so it's maybe like Ozempic face, but it's not anything worse than anything else.
I have some patients that are on these medications, not that I have prescribed, but they've worked with their medical doctors to be on the medication. And what we do is we look at the whole person approach. We make sure that they're eating adequate protein because we don't want that muscle loss. I make sure that they're still stabilizing their blood sugar and eating throughout the day. I make sure that they're exercising so that they're getting that good support to their metabolic system in case they do decide to go off of the drug at some point, that they don't have a big rebound effect. I also ask about their sleep. When you don't eat and your blood sugar gets lower, one of the first things that will impact is your sleep. And so that's the biggest red flag for me, that maybe their blood sugar is getting too low. Because you have to remember, these drugs were designed for people with type 2 diabetes. If you go on the drug and you don't have type 2 diabetes and your blood sugar gets lower, you can put yourself in a hypoglycemic or reactive hypoglycemic position where you have low blood sugar. And when you have low blood sugar, your body will kick in with stress hormones to raise it back up. So if someone starts feeling more stress and anxiety for no reason, if they start sleeping, especially sleeping throughout the night, you need to have stable blood sugar and stable blood sugar stores to be able to sleep through the night. So if you start waking up in the middle of the night, waking up 2, 3 in the morning, your blood sugar is too low.
Yes, weight comes off fast, but there's no easy fix. Movement and good nutrition are vital when it comes to using these meds. But Dr. Reyes reminds us this is a learning lesson, a chance to get back to a good, healthy weight.
For weight loss, the studies have all included 150 minutes of exercise a week. You do need to fuel your body during the day. You need to have a little bit in the morning. You need to have a little bit at lunch. You need to have some dinner. You need to fuel yourself intermittently, as well as you need to expend yourself during the day to maintain cardiovascular health, and so and then to maintain a little bit more calories out, etc. And that is an extremely important part of it. So I think maintaining some sort of a exercise regimen so it doesn't affect it. If you want to keep exercising, it definitely will improve your weight loss. It'll improve your mass, your lean body mass maintenance.
Dr. Reyes says this is not a one-size-fits-all program.
So you have to kind of meet them where they're at, and then the first time I see them, I just might say, listen, just write down what you eat this week, and then I'll see you next week, because I don't even know what it is that they're doing, and then we'll see how their appetite changes and see if they lose any weight with that. The exercise part is extremely important, but it depends on how much they're doing now. And I don't ever say I would recommend 30 minutes a day. And the reason is that a lot of times plateaus will be hit because people are not maintaining their basal metabolic rate because they're not exercising. And it's just part of like being healthy, So, and maintaining a good healthy, like maintaining their mental health while they're doing it. There's so many aspects of it that are extremely important. But there's also a lot of little cardio bunnies out there that are like stressing their bodies. So sometimes we have to pull them back a little bit and get them into the yoga studio. So there's aspects to that exercise portion that we have to appreciate. But I tell them that is not where you're going to lose your weight. Yeah, and I mean, they always say that you lose your weight in the kitchen.
But heads up, not everyone with a weight problem is overeating.
I think it's really important to understand the mechanism that these are working. And so for someone where weight gain is directly related to an overconsumption of food or calories, these drugs are going to have the biggest impact. But we have to remember that a lot of people, this isn't the mechanism. They're not overeating. We have a lot of people that are doing intermittent fasting or fasting type processes, and they're not overeating, and they're still having trouble losing weight because of another reason. And it's important to get to the bottom of that, to work with your practitioner or doctor and figure out, is your thyroid healthy? Are your hormones healthy? What's the inflammation like in your body? Do you have an undiagnosed autoimmune condition? Because if you just take a drug for the point of weight loss, you miss the opportunity to really support your body in what's really causing the weight gain to begin with. Weight loss is multifactorial. If there was a very clear cut, oh, it's just this or it's just that, we would all be happy and the perfect weight that we wanted to be. It is a very complex thing, and with the body, everything plays a role. Oftentimes with weight gain, it's not one singular factor; it's multifactorial. And I think with Ozempic or the weight loss drugs, one of the biggest issues that I have with it is that someone is then under eating. Someone that is using the drug not because they were very obese or had very profound stage 2 diabetes, but they were maybe just wanting to lose 20 pounds, more just aesthetically, that they're then under eating. They're then not getting nutrients that their body needs, that they weren't educated with diet, lifestyle, exercise to support their body. And now they're gonna end up with secondary conditions because they're malnourished or under eating. That is going to complicate their life in other ways too. Some of the biggest drawbacks to these weight loss drugs are that they're expensive. They're by injection. A lot of people don't realize it's an injection. And we're finding that it's not just fat loss. When we lose weight, we really want to lose fat. That's the part of the body that's less helpful for us. And with these drugs, we're seeing equal amounts of muscle mass loss with fat loss. Muscle is so important. All of your energy production from your body, or I shouldn't say all, most of the energy production from your body actually comes from your muscle cells. So when we talk about ATP, mitochondria, energy production, those are from your muscle cells. So having healthy, lean muscle mass is one of the pillars for longevity and health, and having good energy throughout the day. And so when you're losing muscle mass equally with fat loss, you're also losing energy. And oftentimes that's going to backfire in the long run, because when you're tired, you will naturally crave sugar, food, things like that to get more energy. Sugar is a quick energy. And if someone were to go off this drug, they haven't really made their body healthier. And oftentimes they will find themselves gaining that weight back on because they've lost muscle mass, their energy is lower, now they're going to crave that sugar. As soon as they stop blocking the feeling of hunger from their body is going to realize how hungry it is, and we'll see it gain back just as quickly.
Along with the gut issues, Dr. Daniels is concerned about the prolonged use of these medications.
The most common side effects being reported are generally gut-related: nausea, vomiting, diarrhea, and because this peptide is working on the gut. So those are the major side effects that people are experiencing. And then long-term, there have been some animal studies showing an increased risk of thyroid cancers. There have been studies showing kidney issues and potentially retinopathy or vision issues. Most of those studies were related specifically to people with type 2 diabetes. It doesn't necessarily mean this goes across the whole population, but really with any new drug, we're in the waiting game right now to see how is this drug going to develop and what are the long-term consequences, and we just don't know that till there's more time.
Beyond the injectables, is there anything else we can do?
So the other question I get asked is there anything we can do naturally, to mimic this peptide, to support this peptide? And there are things. Berberine is a natural compound that has a blood sugar regulating effect. Again, it's not necessarily something that you would want to take if your blood sugar is low, but for someone that is maybe pre-diabetic or has some insulin resistance, berberine has been shown in studies to be as effective as metformin in reducing and balancing blood sugar and insulin. There are other things that work to support that GLP-1 peptide, like quercetin. Even yerba mate has been shown to stimulate its release. So if you like tea, you can drink that tea. Obviously, these are not going to be as impactful as doing a drug, but there are ways to support it naturally. And believe it or not, even just protein, healthy protein throughout the day stimulates this peptide in the gut naturally.
What kind of protein do we need?
I mean, bare minimum is 20-25 grams per meal for an average woman. Men obviously need more. If you're an athlete, you need more. If you're pregnant, you need more. But 25 grams of protein per meal. The average piece of chicken or steak that would fit in the palm of your hand is about 4 grams of protein, 4 ounces of protein, which would equal about 24 grams of protein.
Which can be tough for vegans.
Oh, yeah. I mean, you can get grams of protein from vegan sources, but it involves combining multiple sources of plant-based proteins. And the issue with that is most of the plant-based sources of protein do involve a carbohydrate. And if you are pre-diabetic or diabetic, the carbohydrates are pushing the system the wrong way for your blood sugar management. And so it becomes very difficult to get the protein you need, but also minimize the carb content that comes along with getting that protein. And then our alternative protein sources are Beyond Burgers, our Impossible Burgers, our soy burgers are just very processed. They are absolutely junk food. They are not food. They are not food in any way. And so, you don't want to rely on those type vegan protein sources day after day, month after month, because it's just like having a junk food meal.
One aspect we haven't touched on is the change in mental attitude with major weight loss.
Kim is a registered dietitian, so I've asked her to come on and talk a little bit about how she feels about these drugs and what are the pros and cons about being on it, and if you are, what's our food like?
The average American gained 29 pounds during COVID. Oof. And we had an obesity epidemic before that. And with obesity comes metabolic syndrome. So we have high cholesterol, high blood pressure, high blood sugars, which is really diabetes, heart attacks, strokes, all these issues. So by losing weight, we course correct all of those diseases. And so I do believe that this medication is a fail-safe for many people who have struggled and who are on many medications. And so now that we've seen what's happening, they're losing weight and they're actually getting off of these medications. And so you know me, I'm all about the sustainability and making sure that somebody can actually keep the weight off. And so I'm really hoping that through this process, they are learning how to change their life.
Yes.
And understand what to do
right.
to keep it off.
The biggest consideration, not about the drug itself, although I think it has some limitations in terms of how people feel. Apparently not many feel good on it. I mean, there's not how many people feel good. Most of them, apparently there's some side effects, guys, of nausea, vomiting, constipation.
Not everybody.
No, not everyone.
Yeah.
They have to report them, and I don't know, I think it's too young or too early to report how many, what's the percentages. These people aren't hungry for quite a long period of time. So do we know, are the physicians giving them the 411 on maybe the foods they should be?
I hope so. It's not so much the foods that they should be eating,
yes,
but the fact that they should be eating.
Right.
And it's not that this medication is taking away their hunger, it's helping them get full. So whereas people never understood hunger before, they're now not having extra thoughts, emotional thoughts about food. And so they're actually able to be in their body and recognize when they're hungry. And because of this medication, they're really only eating what they need, hopefully.
Right.
Some people might be under eating, and that's never good.
Right. Well, and from what I understand, because this is all anecdotal, guys. It's just that I know people who have friends that are on it, right?
Yeah.
And they're not hungry. So then when they finally are hungry, they go, oh, I'm going to eat what I want. And Kim wrote this wonderful book, by the way. I'm just going to bring this forth. This is what you're really hungry for, which is really the bottom line. You'll have to watch that segment because we really go at great lengths to tell you it's not just about eating greens and protein. It's really about what your body's asking for. And to that note, I would say then maybe it's okay. But I'm finding and listening to people that are used to eating chicken nuggets or just a bagel and cream cheese because it fills them. But if you have not eaten for a long period of time from a nutrition standpoint, that's scary because then you might become not only dehydrated but malnourished is what I'm hearing.
But I have to say, they already are.
They already are.
They already don't know what hunger feels like. They already don't feel well. And so now there is this opportunity to fix these things and make themselves feel better. And this is a life raft and giving them a whole new perspective. This is their opportunity and they better take it.
Yes. And I would say too to that, these same people are so happy
Yes.
they're a thinner version of themselves.
Yes.
So
Yes.
that's got to be wonderful. Now, so again, though, we know that we need to, eat well, obviously, for the
Yeah.
nutrients, and move. And I think that's a tough one, too.
I think before you even say eat well, they have to understand the rules of the playground, right? They have to build this solid foundation. If they're trying to build a house on a weak foundation, it's going to break again, and we don't want them to gain the weight back.
Right.
They have to really learn that chicken nuggets may not be satisfying or may not be fixing or course correcting any health problems. And that's going to be what they need to go through to say, okay, I'm going to try grilled chicken instead here and see how I feel.
Right.
But first they have to try what they think they love to get to the next place. They have to have that solid foundation.
Right. Are you experiencing clients now that are on these medications?
Yes.
I'd love for you to hear Kim's version of what you would think a dietitian might say, get the greens with that, or make sure you pack that protein. And you're not really going there.
Yeah. As a registered dietitian, I am. But I'm actually goading them there. I used to tell people what to eat, and then they would gain the weight back. And so I realized I had to let them figure out what they loved, and their green doesn't have to be my green. People are so afraid to eat iceberg lettuce. And the truth is there are thousands of vitamins in iceberg lettuce, but there aren't as many as in kale, where that might be hundreds of thousands of vitamins. But start with the iceberg. I'm here for it.
Game for that.
Yeah.
Right.
Yeah. Mix your greens. It's okay. Try new things.
Right.
Yeah.
Thanks for joining me on the Malibu studio. I hope you found this impactful. It certainly brought forth all kinds of ideas on why you might want to, why you might avoid, and if you are on these medications, the ways that you can be successful and stay successful even when you're not on them anymore. As always, please DM me if you would like to give me a topic to use or something you'd like me to know more of. I'm always interested in knowing something new. You can find me at Lori Corbin TV. So I will see you next week on the Malibu studio.